guys, my name is Latoya Renee, and today I wanted to talk to you guys about my recent surgery and what are the things that I wish that I would have known prior to having this surgery. So let's start from the beginning. I had a labrum tear in my right hip. If you don't know what a labrum is, it's the cartilage that surrounds your joint. So you have labrums in your shoulder as well as in your hip, um, and it keeps your hip kind of in place. So mine was torn. So what would happen is it would almost feel like my hip was going to like dislocate or come apart. It'd be clicking, popping, extreme pain, any prolonged sitting. If I'd go from sit to stand, it was excruciating. Um, you know, at the time I was commuting 2.5 hours round trip for work, and then I was also doing a desk job. And so I was in so much pain, and it wasn't a sudden thing. I think I first started feeling hip pain about 2 years ago. Don't really know what the cause of it was or anything. I just noticed that my pain, there was pain in my hip and stiffness in my hip, and it progressively got worse, particularly when I took my last job in 2023, which I mentioned before was a desk job. Um, I did, steroid injections, physical therapy, all the things, and then nothing was getting any better. And eventually it got worse to the point where my surgeon was essentially like, look, it's worse. Nothing we've done has helped. I've got a slot next week. What do you think? And I was basically like, let's do it, because I was tired of being in pain. He told me that the recovery time was minimal. I'd be on crutches for 2 to 3 weeks, and that due to my previous health history, I should recover pretty quickly. So I was like, okay, let's do it. I also knew that I'd be able to work from home, because if I couldn't physically walk without an assistive device, that would allow me to stay home. So I was like, okay, so the situation is set up nicely for this. And in addition to that, I was already in motion of transitioning to another job, a federal job, and which was, it took about 4 months to complete, and I knew we were nearing the end. So I was like, let's get the surgery done before I transition into this new government role. So I went on ahead and had it done. I literally talked to the surgeon on a Monday, and that following Tuesday of the next week, I was in the OR. I literally had my surgery December 26th, the day after Christmas. So, what do I wish I would have known or realized or better understood as it relates to this surgery? I think the first thing is that I wish that I would have realized that like I was legit not going to be able to sit down on a toilet unassisted without someone for a while. I did not realize that it was going to be that challenging. And you don't think about it, how low the toilet seats are, until you literally are not able to hinge and bend, a major joint so that you can sit down. I wish I would have realized. I wish I would have really realized or fully understood that when my surgeon said, look, you're not going to be able to squat, that really meant like, dude, you're not going to be able to squat, to pick things up, to do anything. I literally didn't realize that I would not be able to do any of it. And like, y'all, I truly couldn't. Like, I couldn't sit at my dining room chair, the toilet, even like getting in the bed, and then, you're sitting on the edge of the bed and then sliding your legs over actually in the bed. That was probably the most painful part of it all, as far as like fresh out of the surgery and stuff like that. Like, just getting in the bed was extremely challenging and definitely required assistance. Even like sliding yourself up in the bed, repositioning yourself, like, was very challenging. And I just did not realize that it was going to be that bad, because I'm just like, oh, it's just one side, and it's just, and I'm fit and all these things. No, dude, like, this is a major surgery. I have 4 sites where they went in laparoscopically to repair this torn labrum. I have what they call anchors. I have 3 anchors, so 3 metal pieces or tough plastic pieces that are holding my labrum together. And it was a lot of swelling and all of that. And it was very challenging to move. It's still challenging to move, and I still kind of swollen here right now. So I wish I would have just better understood that. I think also too, I wish I would have realized that operating crutches is tough. Never used them before. I had to stay on crutches for like the first, I don't know, maybe 3 weeks with 2 crutches. And then the week after, I was able to just use one on the opposite side from my affected hip. So my hip was the right side. I used the crutch on the left side. After that, I was able to walk around freely. I wish I would have known that even though I was clear not to use crutches, that I would still like have a limp to some degree, that I would be very swollen and tight to some degree. Y'all, tomorrow will make, I think, 6 weeks since my surgery, and I have a massive limp. I'm in no pain. Don't get me wrong. I'm in no pain. Like all the pain I was experiencing prior to, I don't have any of it. And in fact, like when I do different motions that I was used to experiencing pain in, when I do it and then don't feel it, it's still very odd to me that I'm not in pain. So I am not in pain. It definitely worked, but I'm still swollen. It gets tight. And so with that, my body just naturally wants to limp, and the limp is so annoying and so exhausting, and it almost in some cases makes me feel like I have to explain myself, because like I said, I just started a new job. I literally just started this new job like 2.5 weeks ago or something like that. And so it kind of makes me feel like I have to explain, oh, I'm fine, I'm not hurting, it's just I'm still, now do I explain myself? Very minimally, but like it makes you feel like you need to, because like, I'm some 30-something-year-old that's limping like an elderly person. So and on top of that, I'm a healthcare provider, so like my patients are like looking like, what's going on? So anyway, but I wish I would have known that I was going to be limping 6 weeks post-op. Now I had my follow-up appointment with my second follow-up appointment with my surgeon today. He did give me clearance to like walk as much as I want, to begin exercising like for real again. Just not any like running or jumping or anything like that. And also I still have to be cautious of like squatting down and things like that. Like, and quite honestly, at this particular point it doesn't look like I'm super swollen, but the way it feels is like very tight. The way I feel right now, like I think squatting would be challenging even if I tried to right now. So, but yeah, so I've been cleared to begin exercising and doing certain things, but I think I'll definitely err on the side of caution, because like my body is not the same as it was prior to this surgery, I will say throughout this process, what I learned is that I'm extremely blessed in the sense that I have a family and children who just jumped in and were immediately like helping me and doing all these things. I never had to really ask for anything. My parents, father, my children, my kids, they all just made this a very much better than it could have been process, and I'm super grateful for that. I look forward to seeing where I am in another 6 weeks, because in another 6 weeks I do meet with my surgeon again. I'm hoping this limp will be gone. He did say that the limp is normal and stuff like that, but I'm hoping this limp will be gone, because quite honestly, it's kind of tiring, So maybe in 6 weeks, if you guys are interested, I'll follow up with a updated video to let you guys know where we are, where we stand. Has anything changed? In 6 weeks, I will be going to see my surgeon. So I'm hoping that I will be cleared to live my life basically at that point, but we'll see. So stay tuned, guys. I'll bring you new content here soon. Bye.